Hi, I'm Dr. Andrew Carlson. I'm a pediatrician here at the Veranda. Welcome. So organized sports, once you're past the elementary school age, do require an annual physical evaluation with a healthcare provider, physician, or mid-level, and completion of a form that's provided by the state of Georgia. So all the schools have a similar mandate, and part of that mandate also is that their coaches and their parents are aware of the possibility of concussion or other head injuries related to whatever that sporting activity would be. So the common ones, football, basketball, really any kind of contact sport is something that you have to consider having a possibility of a head injury. The most common one would be a concussion. So parents are acutely aware, coaches are aware. Most, if not all, of the providers are certified in evaluating children with head injuries, and in fact we would recommend that anyone with a head injury be evaluated prior to returning to that sport activity. You can have a concussion with loss of consciousness or without loss of consciousness, and the symptoms can be very similar, and the healing process can be prolonged. So if in fact a child does have a head injury that requires them leaving the game, then they need to be evaluated before they return to the game. Most coaches these days are well aware of the possibility of injury that would be undetected and place the child at further risk of subsequent injury. If you have one concussion that is deemed mild and you return to the sport that was involved with that injury prior to your healing time, and in fact get another mild concussion, it's no longer a minor problem.